Paola is the Alliance Delivery Manager at HDRUK and is responsible for the management and delivery of the Alliance Work Programme. To do this, she works in partnership with the research community, regulators and funders. She also leads on the HDRUK Accelerating Health Data Access project. Vicky is the Gateway Content and Community Lead for HDRUK, and she's responsible for curating and promoting content on the Innovation Gateway, as well as for improving user engagement. So over to you guys.
Thank you, Martin, and thank you everyone for being here today. So today we're sharing a presentation, myself and Vicky, but we also have Susheel Varma, who's the Director of Engineering, because we're not just talking today, but we're also showing you a demonstration of the Health Data Research Innovation Gateway. So I'll kick off with a presentation and then we'll do a little bit of a role play, so you don't have to listen to me all the time. But I will start with a little introduction about who we are and what we do. Next, please. Thank you. So this is just a little content table of what we're going to talk about. So I'll introduce you to HDRUK for those who are not familiar with our work. Then we'll go into the Innovation Gateway and we'll talk to you about the work to date. And then we'll dive into data access and what we've been doing in this context. We've finished with a demo and hopefully we give some time back to you for questions. Thank you. So who are we? So we are the Health Data Science National Institute, and we are working and operating across the 4 nations. We are spread in theory, spread around all of the UK, and we have 86 organizations participating across 56 offices, although at the moment, obviously, everybody is working from home. We still have a big coverage with research locations that you can see listed here on the left, and with training locations, which you can see here on the right. And then we have health data research hubs, who are centers of excellence, who operating on curation of data sets to improve the use of health data. So we are spread out around. We are really focused on collaborations and working a lot with all of our partners, but mainly we are a central team in the central London offices, and we are relatively small, let's say. Next, please. So our mission, HDRUK's mission, is really to unite the UK's health data and to enable discoveries that improve people's lives. So we're working with custodians and with researchers and really with many collaborators to do that. And what we want to achieve is really our 20-year vision is really to enable large-scale data and advanced analytics that ultimately benefits patient interactions, clinical trials, biomedical discoveries, and finally, and ultimately enhances public health. Next, please. So to achieve this mission, we have a strategy in place which focuses on 3 main pillars, let's say. The Uniting Health Data is really based on work of our alliance partners, which we'll talk about in a minute. The Innovation Gateway, which is an enabler of really the work that we're doing. Then our pillar on improving health data is really drawing attention to those research hubs and center of excellence I mentioned before, which are aiming to curate data sets and making them more usable for research. And then we also work with the using health data community. So this pillar is about bringing together the community of researchers working on health data and really doing data-driven research and providing insights that ultimately benefit patients. So the patient and the public is really, the trust from the public and the patients is really important to our work. And we have a strong team really focused to embed all of the public perception and all of the public opinion in the work that we do. And across all of the projects that we do at HDRUK, the patient and the public are really present. Next, please. So what we're showing you here is the infrastructure strategy that we have in place to make sure that we join all of the dots together. And ultimately, what we want to enable is really the trustworthy use of health data in the UK and possibly beyond. So when you see on the left-hand side, the Uniting Health Data is really based on strong partnerships formed by data custodians and research organizations who are committing to provide access to their data for research. And by bringing this UK Health Data Research Alliance together, what we are aiming to do is really designing recommendations and best practice for the use of health data. And many of the custodians who are involved in this event today, as you saw, NHS Digital and HDRUK are also part of this alliance. The alliance members bring together data sets, and they already make data available for research, but they are very diverse. And so the data sets they cover span from NHS data to cohort data, registry data, trials data, or biobanks as well. And what we're trying to do is really leverage their capabilities, but especially their expertise to really drive best practice. With improving health data, we are using the health data research hubs as our center of excellence to really drive curation, because it's not just a matter of making data discoverable, but it's important that that data is also usable for research. And so these hubs are really focused on that aspect to make sure that the data is actually understood by researchers and can actually be used. With the third pillar here, and again, under Uniting Health Data, is really the Health Data Research Innovation Gateway, which Vicky and Susheel will go into detail in a minute. And is really an enabler of what we are trying to do. We are trying to set best practice, and we're making sure that the gateway is a portal that enables this. And so I won't go into detail, but Vicky will introduce you to that soon. Next, please. And so just to say that all of this work that we're doing, as I mentioned before, is done in collaboration and partnership with our alliance members, but also other partners. If we look at the UK Health Data Research Alliance, we have at the moment 42 members, and this alliance is growing. And these are the logos, mostly of all of them, hopefully all of them, but if not, obviously apologies if there is any organization missing. But this is just to say, again, the diversity of the organizations that are here is really what the value of this alliance is. So you can see the NHS trusts are in this alliance, but as well as big established national bodies like NHS Digital, Public Health England. But then we have the biobanks and very smaller charities like the brain tumor charities. So the diversity of it is really what is encouraging best practice, and having them together and really supporting the work that we're doing is really what the added value is. Next, please. And so finally, from the Alliance, I just wanted to draw the attention to the 5 main work streams that the Alliance is focusing on. And I would say all of the data custodians are, most of the data custodians in the Alliance are involved in these work streams. And the work that we're doing is about improving data standards and quality. And again, this is to make sure that the data that are available for research can be used effectively. Then we are working on a work stream on aligning approaches to trusted research environments. And as mentioned before by Alex, the trusted research environments are something that are environments that are increasingly being used for the safe use of health data. And so this is something that we are keen to work with the community and try to set standards for it. Then we are engaging and involving practitioners, patients, and the public. But I would say this work stream is really across all of the work that we're doing, so across all of the 5 work streams. The last 2 that are highlighted are the most relevant to these to this event today, and is about promoting participation, improving access, and supporting Health Data Research Innovation Gateway. And these are basically bringing together the community to really talk about inconsistencies in data access processes and driving that really improvement on this side. Next, please. And now we're going to talk about the Health Data Research Innovation Gateway, which is really what we think can enable this improvement. And Vicky will start with it, I think.
Yeah. Thanks, Paola. So yeah, I'm going to be introducing the Innovation Gateway and the journey so far. So kind of building on what Paola mentioned and why we established it in the first place and what we've kind of been up to over this year. But I first wanted to start with a poll, which I think hopefully should be pretty prepared. And we just wanted to get an idea of how many of you have heard of the Innovation Gateway before the Researcher Roadshows. I can't see the results, but I don't know if they're coming up. Ooh. Ooh, okay. I will make sure I give a very thorough introduction, but that's really interesting to know. Thanks. Perfect. So the Innovation Gateway was one of the main things we wanted to set up when HDR was establishing. That's because really with the research we did, we discovered there wasn't really one common site or entry point to discover the health data sets that exist in the UK. They're kind of fragmented and held separately by thousands of organizations. And what this means is that researchers were having to visit various different sites to find out what data sets are actually available, what could potentially be useful for their research, and also any information around these data sets. So the Gateway was really kind of aiming to fill this hole and become the kind of go-to common entry point for discovering UK health data sets and also facilitating that access to them in a transparent manner. So as Paola mentioned, the Alliance are really kind of baked into the Gateway in this process. So the important distinction is that the Gateway isn't holding or storing any data sets, but is just listing what's there and what's discoverable to improve that access process. So the Alliance members have listed their data sets on the Gateway, and that's what's available at the moment. So if you go onto the Gateway and have an explore, you'll see kind of data sets listed from HDRUK, NHS Digital, and these custodians are using the Gateway to make these data sets that they hold more discoverable. So it's been just about over a year since we launched. We launched in February 2020 with a minimal viable product, which you can see here. It's not the prettiest, with not too much content on it. And then we've now moved to a portal that's got a lot of content and continues to grow. So we recently passed the milestone of listing over 600 data sets on the Gateway, which is really exciting. We also recently just added a data set from industry, which is our first one. So we hope to increase that content as well. And we've had 231 inquiries or access requests to the data sets on the Gateway, which Paola will talk about a bit more later. And what we have now is also not just data sets on the Gateway, but we've also started to list other health data resources, such as analytical tools, publications, training courses, and research projects. So really kind of trying to make discoverable health data resources from everywhere across the Gateway. And then just to show you here kind of how quick a process it's been, the Gateway is developing in milestones. So we've been working on milestone 2, which will be ending at the end of April. So you can see what we've kind of been developing at a very high level here. But I just wanted to make the point that data access request improvement and kind of, facilitating access to that process has been a very big priority for us and a kind of consistent focus on that. And then just some of the details on what was on the previous slide. Again, I won't go into all of these, but just to pull out some kind of features that we have been developing. So ecosystems, which is kind of interoperating with other data custodian systems that are in place. The federated metadata catalogs, improving the quality of the metadata listed around the data sets on the Gateway, which again, I'll go into in a minute. And also cohort discovery as well, which we're really excited about. And if you're in the afternoon session after lunch, Susheel will be touching a bit more on that as well. And we're currently in the process of defining our milestone 3 development. So lots more work to come. So what content and data sets do we actually have on the Gateway? Again, to make the point, we're not holding or storing data sets, but listing data sets from custodians that are available. And this is really a kind of wide range. So we've got kind of lots of content from cardiovascular to maternal health, primary care, mental health, diabetes, and lots more other areas. And unsurprisingly, a lot of COVID-19 data sets. We've added 79 data sets this year, and the majority of those have been COVID-19. And we really encourage you to go explore what we've got after this session as well. You can search for data sets by keyword and also filter down, which I'll demonstrate in a minute. And then also here are some of the most popular data sets that people have been viewing and requesting access to. So the most requested one is the COVID-19 symptom tracker data set. So that's the Zoe app that a lot of you might have on your phones, which has its data access route exclusively through the Gateway. And then also recently we've added the COVID-19 vaccination data sets as well from NHS Digital. You might have heard this mentioned in the previous kind of roadshow talks, which is really exciting to facilitate access to this. So just to show you what the gateway kind of looks like and how you can kind of drill into the data sets. So here you can see I've searched for X-ray just as a term. And then we've got 7 data sets that kind of have that term in it or are kind of keyword related. And then what you can do here is use the filters on the side. So you can filter by license, kind of phenotype and geographical coverage, for example here. And then if I click on one of the data sets, so this one is the National COVID-19 Chest Imaging Database, which is listed by NHSX. Then you can see here we've got a description about the data set with kind of the background of it and what it can kind of contain. And really, we're working very closely with the data custodians to ensure these kind of descriptions are as up to date as possible and have lots of details. And we also have something here on the side, so this little rating here. So each data set we've rated for its metadata richness. So it can be bronze, silver, gold, or the highest is platinum. And the idea behind this is that for researchers visiting the gateway, they can just kind of eyeball how much metadata and description is around the data set. So they can kind of quickly get an idea of how much information is available. And also what we have here, if you kind of scroll further down in the data set, are various other kind of descriptions. So you can see here we've got the geographical coverage of the data set, the age range that's included in it, and also actually processing time for the access request. So really by kind of having these technical details in place, we really hope it makes it easier for researchers to work out whether a data set could be of use to their research. And also we hope to kind of improve this efficiency for the data custodians as well, that if this kind of information is detailed and available up front, it will kind of avoid them having to be asked a lot of questions about the data set. So that kind of increases that efficiency there. And then lastly, about half of our data sets on the gateway currently have this technical details tab, which kind of drills down even further into the data, can kind of tell you the fields that would be available in the data set as well. So as well as data sets listed on the gateway, I mentioned as well, we also have associated health data resources, such as the tools, publications, courses, and research projects. And for these, anyone can add these as opposed to the data set. So we would encourage you, if you've got any kind of related papers or tools or research projects that you're working on, to add these to the gateway so we can really kind of grow that content and showcase what health data researchers are working on. And also here, what we're aiming to do with the related resources is interlink them a bit more. So you can see here on this data set in the related resources tab, we've got a list of the kind of current projects that are working on this data set, and also a paper that's come out from using this data set as well. So we're really hoping to kind of improve that collaboration, and that if you kind of visit a data set and see a kind of current project that's working on it, potential for kind of collaboration, and also tracking the outputs from the data set as well. And something else we're doing as well with this kind of interlinking the resources is anyone is able to create collections on the gateway. So these can be thematic in a specific area or linked to something like a study project. And a good example of this is the hubs, which are represented on our gateway, which Paola mentioned in her introduction. So these, I'll show you an example here. One of these is the NHS DigiTrials Hub. So you can see here it's got its own description, and then all the related resources are linked into each other in its collection. So the data sets, papers, and projects as well. And then lastly, just for this section here, I just wanted to highlight that the Gateway has a community forum, which is a little bit quiet at the moment, but we really hope to kind of grow it so it can be somewhere where you can connect with other Gateway users. At the moment, we have a lot of feedback on the Gateway through the forum, which our designers and developers then take on board and help to develop new features. But we also want it to be a place for broader discussions around health data in general. So we'd really encourage you to visit that and start any kind of topics or categories for any conversations you'd like to be having with other users. And then I'm now going to hand back to Paola just to cover data access in a bit more detail.
Thank you, Vicky. And so this is just 5 minutes to introduce you to the work on data access before we go into a demo of the Innovation Gateway and show you and give you an example of how it's possible actually to request access to health data. Next, please. So I just put this slide in just to introduce you to the problem around data access. And it's something that perhaps is not new. And actually, this is the result of a survey that was published by the National Cancer Research Institute last year, when they were investigating the researchers' experience when accessing health data. Some of you have already accessed data, many haven't yet. But obviously, there are some issues around accessing data, and some of those are those that we want to really tackle together with our partners and data custodians. So when researchers are asked about their needs for accessing health data in the future, where do they feel they would need most support? Often the first two answers are support through the whole data access process is what they need, and also improving timelines for application approval. So it is well known that sometimes it can take a long time. And while I guess this is 1 year old and we had a pandemic in the middle, and while COVID-19 research might have been accelerating for obvious reasons, what we want to try and do now is really understand what went well in terms of accessing data during the pandemic, if there is any acceleration, and see how we can retain that for future research and not just in the context of COVID-19. So that's basically where we're coming from and why we're really trying to work on this. This was our aim before the pandemic, and obviously during the pandemic, it became even more important. Next, please. So what we're doing with the Innovation Gateway and why we think we can streamline data access is because we see the gateway as a way to support a streamlined, proportionate approach to access requests, which is based on the 5 safe models for research and innovation, and also that uses a clear public benefit and has that in mind. We want to make life easier for both the requesters, so the researchers and innovators, but also the decision makers and the custodians to streamline their processes and make it easier. And then again, I want to stress again the importance of cross-sector best practice, and the expertise of the people involved is absolutely crucial to do that. Next, please. And so what we're doing in the gateway is really trying to provide a solution to data access request management for different data custodians. As I said, there are a diverse pool of data custodians. We have those who have existing in-house web-based workflow solutions already. So the gateway here, it is important that we see how the gateway can fit within those systems and if there is a possibility of integration. Then we have those data custodians who are using paper-based documentation and offline workflow. And what we would like to propose is really an online system for them. And then we have the new data custodians, those that are setting up the new processes right now. And obviously, the gateway can offer a brand new solution to that. Next, please. And so in terms of our work so far on improving data access, we really work with Alliance members, but not only, because we also involved a lot of other stakeholders, including researchers. We work with many partners to really come up with a common data access form, which is based on the 5 states, as I said before. The 5 states is a framework developed by the Office for National Statistics, which has in mind the safety of the projects that are proposed, and so the public benefit has in mind the safe settings and the environment where data is accessed and used, the safe outputs so that we avoid re-identification, and the accreditation or the kind of the validity of the people who are accessing the data. So all of these principles are considered in what we came up in terms of a data access form in the gateway. How we did this is through an harmonization process to kind of identify a set of essential questions which were common to most of the data custodians. So we talked to many data custodians and we analyzed their forms, and we came up with what we thought was essential minimum set of questions that all of them asked. Because at the moment it's slightly different, but some of the questions are very similar. So we launched the first iteration of a 5 safe data access form in the gateway for 161 data sets and 7 data custodians in December 2020. So it's very, very recent. And at the moment, we have received 29 data access requests in this couple of months. for 90 data sets requested. And I have to stress this has been done mainly through a work program that is being accelerated by the COVID-19 research, and I will show you in my last slide. On the right-hand side, you see a screenshot, but I'm not going to go into detail on that one because Vicky and Susheel will show you in a minute. Next, please. So this is just a timeline to show you the type of work and the type of functionalities that are now available in the gateway when we talk about this data access management module for some of the data custodians and some of the data sets, not all of them yet, to say. And just to say, without going too much into details, we'll share these slides afterwards, is that we started from a static inquiry form for data custodians, where basically every researcher could just ask and inquire about a data set, to now when we have an actual application form for data custodians and for specific data sets, where the researchers can fill in the form online, can submit an application, and that application can be taken forward by the different data custodians. And just if you see Q4 2020, we have this situation at the moment. So we have the possibility, the researchers have the possibility to request multiple data sets from a single custodian. But where we want to be in the future, near future, we are still setting the different milestones for the gateway to achieve that, is really that we will have researchers able to request multiple data sets from multiple custodians, with the use of the one data access application form, which is not the case at the moment. So obviously this is the future, we're not there yet, but with all of the functionalities and improvements that we are implementing at the moment, based on the feedback received by data custodians and researchers, that's where we want to go. Next, please. And this is just to show the different people and researchers and organizations involved in all of this process that started in April last year. So again, during the pandemic, obviously, this has been accelerated a lot. And we started with mapping the landscape at the beginning, and then we ended up producing a data access form. And here in the middle, when you see data access research questions, are the organizations who directly inputted on the data access form that you see today. Milestone 1 was really an important milestone, because we had we managed to have specific partners involved in launching the 5 safe forums, and many of those were the national trust research environments, which are also our delivery partners for the national national co-study data and connectivity program, which is one of the programs that have driven this acceleration. And next, please. And just here to say that this is really the impact that we're seeing already. So this national co-study program has been endorsed by the government at the beginning of the pandemic, and we are helping the different thematic national co-studies to access data in a timely manner. And they know that all of the trusted research environments partners, so NHS Digital and the various devolved nation trusted research environments, are really on board on this program with us, and they are really making COVID-19 related data sets discoverable via the gateway, and they are currently using the 5 safe forms as part of the gateway itself. And we're working really closely with them to really improve the functionalities of the gateway. And I think I stop here, and I think Vicky and Susheel will show you briefly what it looks like.
This is the fun bit. Can you see the gateway screen there? Is that all okay?
Yes, we can, thanks.
Great. Okay, so we're going to do a dummy demo here where I'm going to pretend to be a researcher, and I'm going to show you what it looks like requesting access through the 5 safes form. And then we're going to switch on to Susheel's screen, and he's going to show us what it's like to be the data custodian and receiving that application. So this is the gateway here. I'm just going to search for this data set, which is our practice data set for any kind of demos we want to do like this. So anyone can sign in, anyone can view any of the data sets on the gateway without signing in. But if you want to request access to a data set, you will need an account on the gateway, which is free and really easy to register for. So you can see I'm signed in here, ready to go. And then I found this data set that I would like to request access to. So I'm clicking on this how to request access button here. And you can see there's a lot of information and guidance around submitting an application, kind of what you'd need to do around access, and kind of some useful resources as well. But also one of the features we have is that you actually can message the data custodian before or during your application, if you just wanted some more information on a data set or things like that. So I'm actually going to do that here and send a message to the data custodian. You can see me and Susheel have done this demo before, so just ignore the previous messages, but I'm going to ask, how long can I have access to this data set for? And I'm going to send that message. So while I'm waiting for a reply, I'm going to still go in and start my application process anyway. So I click this request access process. And as Paola said, this 5 safe form doesn't exist for all the data sets on the gateway. Sometimes if you click that request access button, it will just take you to a simple form and just connect you with the data custodian. But this is the 5 safe form that we've worked really hard on and we want to show off. So you can see here on this about this application bit, there's various kind of sections around selecting data sets you need. You can invite contributors, making sure you've read the advice from the data custodian, checking what approvals you might need, and understanding what happens after you submit the application. And then there's 5 different sections on the application which represent that 5 safe process, as we mentioned. So here is kind of various basic information, and then it will be kind of what your funder information is, kind of declarations of interest, what you're going to do with the data and things like that, lawful basis as well. Each has got a lot of information. And then also for each question, you can click on this guidance button as well, which will give you information a bit more on kind of your answers and potentially what you'd need to fill in, which is really useful. So I filled this in already to get it all ready for this demo. So you can see here, I think I filled everything in. So I'm going to click submit application here. And you can see here, it's now flagged to me that I haven't filled in everything. So I click OK. And here it's got a mandatory question that I haven't filled in. So I'm going to say no for that. And I think everything else should be done. So I'll now double check and I'll submit my application. I thought I did this one. There we go, making sure I filled in every answer. And this time it's submitted. So you can see here, this is now in my data access request bit of my account. You can see the data set I've submitted and when I submitted it. So I'm now going to stop sharing and hand over to Susheel, who will show you what it looks like from the other side.
Thanks, Vicky. I'm going to quickly share my screen. So I'm just going to quickly show. So this is the gateway, as you've seen in Vicky's slide. Once you log in, you can log in through Google, LinkedIn, or if you're part of a higher education institution like the University of Sheffield, Birmingham, and so on, and even at some NHS organizations, you can log in to the gateway. So I've already logged in, so I don't want to go through that. Once I get to my account page, so this is my account page, I can see my messages that's come up for me. So this is Vicky's message that she sent. So I'm going to say 3 months as usual. You can see, so this is a test data set. So you can use this data set for your own purposes, so submit the application to yourself, and we will be able to respond to help you out to work out any issues through the submission process. So I've sent that message back to Vicky in terms, so this is a back and forth between the researcher and the data custodian, and the data custodians will be notified by email. They can then respond, and that back and forth is before submission. So usually this happens to learn a little bit more about the data, any ethics review that they might do. All of that can be discussed before they submit the application. So this is me with my profile. I can then swap over to my data custodian profile. So I'm swapping hats now, and you can see, you know, for our test data set, I can see Vicky's research project that's been submitted. I can also show you all of the members of the review committee. So any one of us can review this access request and then be able to provide feedback to the researcher. I'm going to swap back to the research project submission, so I can start. So here you can see a list of all of the submissions that people have submitted. Some have been approved, rejected, and in review. I can start the review process. So at this point in time, the form is frozen as far as I'm concerned. The submitter, so Vicky in this case, cannot make edits. I can have a look at the application. I can look through all of the forms, enough information. I can highlight certain things. So for example, if I wanted to say, okay, I'm not really sure if there's an organization, I can flag that up with them, with the researcher, and that information will be sent out. I'm not going to do that in this instance, but for each detail, I can flag that up and ask them for more information if I wanted to. So in this case, so once I've gone through the entire review process, I can make a decision. And here I've got three options: approve with conditions, and reject. If I click on one of the options, I can say, great project. Please sign our data sharing agreement, and then confirm an approval with conditions. And that is now approved. I can see the list of all the approved projects, and you can see that here. And I'll stop sharing so you can see what Vicky gets as soon as I've approved it.
Okay, I'm back on. So you can see here, we're back to my account as a researcher. So I can see here that Susheel has replied to me with the 3 months. And you can now see that my submitted data access request has now moved to the approved tab. I've also got a notification about this, and you'll also get an email about this as well. So it's now approved, and you can see Susheel's comment there as well. So I can message him back and we can get sorted in the data access. So that's kind of the data access process in a nutshell. And I've just got a couple more slides before we finish for questions. Yeah, so I just kind of wanted to show this slide to show that I hope that we showed you that the gateway is working kind of across all these various different areas, from discovering data to improving and linking data to making it accessible as well, that we really hope will kind of drive these data-enabled research discoveries that then go on to improve people's lives. And then lastly as well, next steps for getting involved. We'd really encourage you to go onto the gateway, explore the data sets and the other resources, and add your own papers, tools, projects as needed, and also create your own collections if that's something you'd like to do too, and go visit the community forum. And we also recently launched our development and improvement user group, where we're getting a range of audiences involved in our design sessions and development of new features for the gateway. So if you'd be interested in this, do give me an email there, and I can give you some more information about what's involved. And then lastly, we run really casual, informal open door sessions on the second Thursday of every month. So we'd love you to come along to those, and where we chat about kind of new developments and new content on the gateway. April's open door is actually going to be a cohort discovery themed one, where Susheel will again be demoing the new feature. So if you can't make it this afternoon, I would really encourage you to sign up and register at Eventbrite. Or if you want to see it twice, also exciting as well. But yeah, that's everything from us, and happy to take any questions.
So there's a few questions in the chat. I'm just going to raise that up as I go along. So please jump into the chat if there are more things that haven't addressed. So the first one is, so I've answered a few of them in the chat itself. So the one that I'm going to pick out is how long. So Carol Fogg is asking, how long would it take for a data access request to be a process, so the access required for the data set? So she's saying we found it very challenging to get data from several data sources within the grand timelines, and this is a common issue. Paola, is there something that you can answer?
I don't have an easy answer, I'm afraid, and all I can say, probably it is very variable and it depends. So yes, it's an issue. It's one of the main issues that researchers keep reporting on, and that is one of the main issues that we're trying to tackle in a way. How long it takes, I can't answer that question. And the custodians obviously are managing the application processes, and that depends on the quality of the application that they receive and the information that they need, because they need specific information. Sometimes it is they don't receive it the first time round. So there is going to be some time that the researchers will spend together with the data custodians discussing the requirements, and that back and forth might take time. So I'm afraid I can't answer specifically the question, but that is often what takes time. In terms of what we are trying to achieve is really trying to help at the beginning of the journey with providing maybe and working, like for instance, even with the MRC Regulatory Support Center, providing better guidance, better information at the initial stage, making it clear what is needed for researchers to go and access data, if they need any specific training, if they need accreditation, and have those in place before submitting a data access request. And also having all of those kind of covered at the beginning of the grant application in a way. When you are requesting funding, obviously you need to have in mind that you will request data and that will take a certain lag time to do that. So there's always a tension when to apply for grants and when to apply for data. So I think those things need to be thought at the outset. And I think that's the type of work that we're trying to do. And again, very helpful to have input from researchers actively experiencing these problems. So
I would just
reach out, please.
I would just say as well that some of the data sets, not all of them, do have a rough kind of access time in the technical details on the gateway. Obviously, this is an estimate, but the one I showed, the chest imaging data set, said 2 to 4 weeks, but obviously that depends, like Paola said, on the back and forth. But if you do want to look on the gateway, sometimes it might tell you a kind of rough estimate of access time.
And just to add one more thing, we are also tracking the time it takes for access approval to happen on the gateway. So not everything will happen on the gateway because some data custodians are not using the gateway fully. So for the ones that are being tracked with the gateway, we can estimate a rough mean value as to how much time has been taken. So in our health data research example, I can look at it right now. It's 17 days. From submission to approval, although this is a test data set, obviously. So the next question is from Wendy Craig, and she's asking, how does this process work with NHS Digital DARS process and the contractual requirements?
So in terms of NHS Digital, so NHS Digital listed in the gateway, so they have many data sets listed in the gateway, but in terms of the method of application form, so which application form they have for some data sets, and specifically the ones relevant to COVID-19 and the ones that are part of the national core study, they are using the 5-stage form. How we're working with them at the moment is really trying to send them the information from the gateway to the DARS system so that they can take the information from the gateway, input it into the DARS system, and then process it at their end. And at that point, obviously, the gateway doesn't have a role. The management of that application at NHS Digital level is going to be done by DARS. In terms, I just want to say, so in terms of integration, we are also working on making that process a bit smoother, so that there is a seamless integration between the gateway information and the DARS system. We're working with them towards that. Just to reiterate, at the moment, the COVID-19 data sets are the ones that are using the 5-stage forms, which is sent then to DARS.
Thanks, Paola. The next one, I don't know how much time we've got left. Oh, we've got plenty of time, so that's good. There's loads of questions. So this is from Jenny Wheatman. When thinking about making multiple applications for access to dataset, is it likely that a platform will be developed similar to IRAS to manage and coordinate all of the applications relevant for a single project? So
here we're talking about the future. So I think so. Well, the idea is that the gateway will enable that. And obviously, Susheel, please jump in because you're definitely technically more savvy than me on this one. But the idea is that it's going to be possible for a researcher to fill in an application, one application, specifying what data sets they need, even if these data sets are from multiple data custodians. And then this form, once ready to be submitted, will be submitted to the relevant parties. So creating kind of an online virtual team constituted by different data custodians who will be able to review it online via the gateway. Obviously, this is what we're trying to achieve. And also those data custodians need to come up with an approval process so that that researchers receive an approval by the relevant data custodians at once. But we're working from a technical perspective to make that platform possible via the gateway. But also, obviously, we need to work with the data custodians who are willing to do this, and they need to have a system in place to agree that they can use this platform, they can provide approvals via the platform. But that's obviously not yet the case at the moment.
Yeah, so to answer to your question, Jenny, technically all of this is possible. It is not rocket science. We've got systems in place to do all of this. The problem is we're working with the data custodians to try and get up the process, the back-end process that Paola mentioned, between, let's say, Energy Digital and ONS, if those are the two data sets you want to combine and link together. How can we support them to provide a service that they can have those interactions seamlessly, and the approval is all held within a single location for the researchers' benefits, and all the two organizations can also see the changes that's being made to that application. So that process is the challenge, and that's what we're working through and ironing out as we go along. So the next question is from Ash. I think I answered the first one around the HES data set. The secondary question is the gateway a tool only to find out about metadata? Shall I take this one, Paola?
Yes, please. You're Vicky, absolutely.
Yeah, so very quick answer to that one. The gateway is primarily a metadata registry. It does not hold any data at all. What it does hold is who has the data, what type of data it is on the technical metadata, and the capability to fire off research project application data access requests into the few data custodians that has 5 safe forms, but also submit inquiries to other data sets on the gateway. So that's its current capability. There's a few other capabilities that I'll be demonstrating later on today, but there are other things that's in the pipeline to allow you to do a bit more than discovering data and accessing and making an access request to the data. The next question is just a clarification from Batul Almeri. Hi, I'm looking for data around staff and management's well-being and management practices, example, supervision, line management sessions, etc. Thank you. So this is more around administrative data, and we have that on the gateway.
So am I asked Vicky to answer this one as content lead?
I think we do have some of this content. I think we definitely have some content, maybe it's not quite the same thing, but around kind of like working conditions under COVID and things like that, I think is definitely available on the gateway. I would say go and have a search and see what's there. I realize it's not the best answer. But yeah, we would encourage you to kind of go and explore what's on there already, but I do think some of that is on there.
Yeah. It is possible to, just to say, it is possible to do a search by using keywords in the search bar for the gateway. And then also it would be interesting if you do not find what you're looking for. It would be interesting if you could get in touch with us, because we can investigate.
Yeah, we're definitely looking to add a lot of more content and not kind of stopping there, kind of.
Yeah, so to answer your question a little bit more, we do have some data sets from the ONS, which are administrative in nature. So that does have that information, and from Energy Digital and others as well. But we won't have we don't admittedly have a UK-wide coverage of that data, because there are other routes to get hold of that data. So particularly HDRUK would be a good route to get hold of those kind of administrative information. So the next question is from Ash, which is a very pertinent question. So what are the advantages of going through the gateway rather than going directly through NHS Digital, for example?
So I maybe start, and then please come in whenever. So I would say what ultimately we're going to achieve, hopefully we will, is really giving this possibility to request for multiple data sets. If you are at the moment asking 1 type of data, only one data set from NHS Digital, we would actually encourage you to go directly to DARS and to NHS Digital, because it would be faster actually if you have one relationship. If you are asking for more data sets, and both if you also asking for linkages, perhaps there is an added value going via the gateway, so that we on the other side that can be made possible hopefully a bit more easily. What we're doing now in terms of providing access and the acceleration that we have in place at the moment is a partnership, and is driven by the National Core Study, and that is for COVID-19 related research. So it is specific to that. But by doing that, we are trying to understand what are the challenges and what are the possibilities, so that we can retain what is possible, and hopefully the gateway will allow that kind of acceleration for other type of research as well. So I don't know if I've answered the question completely, but I think the ultimate added value of the gateway will be when it's going to be possible to request multiple data sets from multiple custodians. And Susheel, I don't know if you want to.
Yeah, and just to add that what the gateway form represents is essentially harmonization for the researcher, rather than going to multiple data custodians with multiple forms to fill in multiple fields around multiple projects. You have a single place where you can submit that form, and that's harmonized to as much as to an extent as possible on the gateway. So you have at least a single place where you can manage all of that request, especially when you're dealing with multiple data sets from different data custodians. Our direction of travel is just try and make life easier for researchers as much as possible, but also make life easier for data custodians as well, so they can process a singular template of information that's been collected from the researchers. The next question is from Nehal Hassan. I know there's a few more being put into the chat, so let's go through them very quickly. The first one is around, can a research access demo data set of interest to make sure that I'm applying for the right data set? So I can probably answer that question quickly. So we don't have synthetic data or fake data on the data set. It is usually not encouraged. Usually the encouragement for the researchers to go and look at the data set. At least we have technical metadata for about 49% of the data sets on the gateway. So once you have that view, you can then make an access request to the data, but it is an actively researched project. The issue with showing demo data or fake data or synthetic data is even that can be identifiable in certain circumstances. So we need to have DPI control over even aggregate statistics to be shown onto the gateway. So again, that is the limiting factor there, and hence what usually would happen is have a discussion with the data custodian themselves. They might be able to give you synthetically generated data that they might have generated for the project for you to have a look at. The next question is the same as we discussed before. What is the advantage of that? So Martin Williams asks, one of the goals seems to be to encourage data custodians to harmonize some of their approval process. Is that correct? If so, how far, fast, and how many data custodians are working towards this? So very quick answer to that is it's similar to the earlier question. We have 5 big, large national data custodians working on that, but we are also working with the other alliance members to try and harmonize that process as we go along.
And just to add very quickly, Susheel, as well, we have one of the research hubs already using that form and streamlining the process, and we have one other data custodians, which is HDRUK 4C, which is COVID-19 clinical network, already using that in the context of COVID-19 research. But we have also active discussions with Cystic Fibrosis Trust and the neonatal National Neonatal Research Database, who are also coming on board soon.
Great. Do you have links with the UK data service? Many people might find you via that route.
Yeah, that's a very good question and very timely, because at the moment we increasingly have longitudinal cohort studies in the gateway, and we're actively discussing whether we should link up with the UK Data Archive. We haven't done that yet in practice, but we're definitely discussing this, and we will, and probably that is going to be very helpful for some researchers.
So the next one is from Lawrence Mosley. If someone has an approved researcher status from the UKDS, so the UK Data Service, and is that recognised by HDRUK, or do you have applicants to follow an additional approval process?
Yeah, so the aim, so obviously with all of this process, we are also encouraging to use trusted research environments, and based, given that we're also endorsing the 5 safes and the ONS system, we are collecting information about accreditation to provide enough information to researchers to what to do when they need to ask access. What we're doing with the data custodians is trying to agree or kind of come up with a common framework so that researchers accredited via that accreditation might be recognized by other data custodians. And I have to say, most of the data custodians like SAIL and also in Northern Ireland might use the same accreditations. Not all of them do at the moment. For instance, NHS Digital require the SPT because normally NHS Digital provide access in an organization to an organization. So there is that safe setting component to take into consideration, but we're working towards that and towards harmonizing that as well to make it easier so that it is understood what a researcher accredited status is and can be recognized.
Thanks, Paola. And I think the final question is, would it make any difference for the decision made if the request data is identifiable or de-identified? I think Alex also answered to that. Yes, you want to access, if you want to access the identified data within a TRE, that will be easier than being sent a direct extract, and a lot easier than being sent a identified extract. So anything you would like to add to that, Paola?
No, I think that's pretty much so, and I guess the differences would be between also filling in the application, that the information needed for the identified data might be different, it might be slightly easier and shorter to answer as well.
Yeah, so the default is, if you're going to be using identifiable data, our recommendation is to try and use it within a trusted research environment which has built-in security perimeters. It's very unlikely that people will send you an identified data extract unless you have your own trusted research environment sitting next to you, which has gotten all the security approvals and perimeters in place. Anybody's question that I've missed? I know we went through a lot of them and answered that in the chat. If I haven't picked up your question, please drop that into the chat. We've got 1 more minute, so we'd like to get through. If I missed any, please drop us an email to Paola, Vicky, or me, and we'll be able to answer that directly as well.
So thanks, folks. That was a great presentations. Fascinating insight into the back end of some of this databases, and so we can see what you see. It's really great. I noticed that you're flagging a workshop on the 26th of March. Have you put a link to that into the chat yet? If not, could you? It might be helpful to do so. So great presentation, great responses. I think you covered most of the questions, so well done there. So it's now time for our lunch break. We'll stop now and invite you to join us again at 12:50. We'll be taking a deeper dive into data governance and some of the tools and facilities available through HDRUK.
Thanks, everyone.
Thanks.
Thanks.